Hi, I'm Dr. Lauren Wood, and I'm here today to talk about bowel and bladder control. I work here at Urology Specialist. So if any of these scenarios is familiar to you, will I ever gain control again? Will I ever be able to attend a wedding or an outdoor celebration? How could I hold down a job? How can I get a date? I'm always thinking about the bathroom. If these things are bothersome to you, then you may be a candidate for treatment. Up to 50% of patients have not discussed incontinence treatment with their doctor, and 44% of patients are embarrassed to talk about bladder control problems. Well, as a urologist, I can tell you that's pretty much all I talk about all day, and I'm more than happy to talk about these things with you. The great news is that bowel and bladder problems are not inevitable. So if you're urinating more than 8 times a day or about every 2 hours or more, have the feeling that you have to go right now, are planning activities around the bathroom, monitoring how much you drink, using pads to control your leakage, or waking up multiple times to urinate, then your body is trying to tell you something and that this is not normal. So incontinence can affect men and women of all ages. In fact, 1 in 6 patients suffers from urinary incontinence. That's more patients that have incontinence than that have diabetes in the nation. 1 in 12 patients suffers from overactive bowel or leakage of stool, and that's 21 million adults in the United States. So ignoring these problems can lead to even worse issues like loss of sleep, loss of your confidence or self-esteem, or just poor general feelings of health. The good news is that we have treatment options available that can get you back on track and get you living the life that you want. So what causes bowel and bladder problems? Well, we don't always know, but sometimes certain things you eat or drink can make the problem worse. Medications that you take, often fluid pills or diuretics, or prior surgeries, childbirth, pregnancies, or pelvic floor injury can all be risk factors. The bladder is controlled by the brain. And so once our kidneys make urine, it's stored in the bladder. When the bladder is about half full, it sends a message to the brain to tell you when to pee or when not to pee. When that miscommunication occurs between the brain and the bladder, oftentimes the result is your bladder becomes overactive and you can lose control even of your bladder. Very similar pathway for the bowels. So the digestive system pushes food through the intestines, and when the rectum is full, it stimulates nerves. The nerves in your brain are what tell your rectum to relax in order for you to have a normal bowel movement. If a communication breakdown occurs, then loss of bowel control can ensue. So there's 3 common bladder control problems, and we'll talk about each of these. The first is stress incontinence. Stress incontinence is leakage of urine with activity, like coughing, laughing, or sneezing. It can also occur when you exercise, bend, or lift. This is different from overactive bladder. Urinary retention is when you can't tell if your bladder is full, you're not able to fully empty your bladder, you have a weak stream or dribbling, or you need to use a catheter in order to empty your bladder. Overactive bladder is composed of urgency, frequency, urge incontinence, and nocturia. So urge incontinence is when you leak before you make it to the bathroom, or even you're not even aware of leakage. If you have to use pads for protection or changing pads daily from urge incontinence, treatment options are available. Urgency and frequency can also occur without incontinence. So if you're peeing every 15 minutes, every half hour, every hour, or waking up several times at night, or just feel that you have the constant urge to urinate or that your bladder is never empty, you may be suffering from overactive bladder. Fecal incontinence is the involuntary loss of stool or gas, and this can occur with a strong urge or even without even realizing it passively. So if you're planning activities around the bathroom, have pads for stool, or see stool in your underpants when you go to urinate, then you may also suffer from fecal incontinence. There are many ways to initiate treatment for bowel and bladder disorders. The first and easiest step are lifestyle modifications. If you hear nothing else today, please know that unless there is a very specific medical condition like kidney stones, most people do not need to drink 8 glasses of water a day or any number of glasses of water a day. You just need to drink when you're thirsty, just like you just need to eat when you're hungry. If someone told you to eat and eat and eat and eat all day long, even if you weren't hungry, you wouldn't do that. That doesn't make any sense. It's the same thing with water. And so many people believe that you have to drink water to be healthy, and you need to drink when you're thirsty, but really that's enough. Also, we know that caffeine and alcohol are diuretics that can irritate the bladder. So frequently you'll have to pee more after your morning cup or two of coffee. If you can eliminate or minimize at least the caffeine in your diet, this may help your bladder control problems. If lifestyle modifications like cutting back on caffeine, cutting back on fluid, peeing on a schedule, or even Kegel exercises are not enough, the next step is medications. And if medications do not work for you, then the great news is we have advanced therapies that can be really helpful. We talked briefly about these lifestyle modifications so far. And I would say if you're not leaking, but you feel that constant urge to urinate, try stretching out that time little by little every week. So if you can only make it an hour without urinating, try to go an hour and 15 minutes. As long as you're not experiencing pain or leakage, it's safe to do this to try to retrain your bladder. If you leak because you've waited too long, trying to time your trips to the bathroom every 2 hours or so may prevent some of those accidents from happening. There are 2 types of oral medications used to treat overactive bladder. The first is a class of drugs known as anticholinergics. And I am not a big fan of these. I do not routinely prescribe these to patients because the side effects can be really bothersome and include dry mouth, constipation, blurry vision, and most frighteningly, dementia. You heard that correctly. So we know that in patients over 55 years of age, using anticholinergics can lead to an increased risk of dementia. That's not a risk I personally would be willing to take, and I would not ask my patients to do that either. So I pretty much ignore that class of medications. The other class of drugs that I do like to use are called beta-3 agonists, and they help by relaxing the muscles of the bladder that are overactive. There's 2 in particular that I use, Myrbetriq and Gemtesa. These are great new drugs, but Myrbetriq can cause high blood pressure, and both of them can be kind of expensive. If they work for you and your insurance will pay for it, that's fantastic. A medication may be all that you need, but it is really important to talk to your doctor about the side effects of your medications and make sure that what you're taking is safe for you. We know that patients are so dissatisfied with their bladder treatments. 82% of overactive bladder patients are not adherent to their medication at 12 months, and only 1 in 5 patients are extremely satisfied with their current treatment. We also know that patients often don't come back, and I think that's because they don't understand that more treatment options are available if the first or second line of therapy doesn't work. The great news is we do have advanced therapies, and I'd like to discuss those with you. The first is Botox. So just like you could inject Botox for migraines or for wrinkles, any muscle that you don't want to squeeze, you can use Botox for. So your bladder is a muscle, and your bladder, when it's overactive, is squeezing without your permission. So Botox is injected with a camera about the size of an ink pen through the urethra in various spots in the bladder. It takes a week or 2 to take effect, and the effects can last anywhere from 4 to 10 months, but on average about 6 months. The downside to Botox is 1 in 5 patients may get a bladder infection, but we do give antibiotics at the time to try to prevent infection. And 1 in 100 may need to catheterize, which is needing to empty your bladder with a tube. This would be temporary and would always wear off. However, a lot of patients find this very off-putting and choose not to undergo Botox for this reason. Keep in mind, you must have repeated injections for the treatment to continue to work. Tibial nerve stimulation is another great option. This is done with weekly in-office visits for 12 weeks. The appointments last approximately a half hour, and the tibial nerve is stimulated with a small device similar to an acupuncture needle. Eventually, we can taper off the frequency of treatments and do this monthly. This is a great option for patients that live locally and have the time to pursue this therapy. And lastly, we have sacral neuromodulation. The great thing about sacral neuromodulation is it is very long-lasting treatment, and the newer batteries have a life of about 10 to 15 years. The benefit to doing this is we test it before we implant it surgically. So it is a testable, reversible procedure that we do in office with just a little numbing medicine and some laughing gas to see if this treatment might be right for you. I simply numb the area above the buttocks and float 2 electrodes underneath the skin that stimulate the bowel and bladder nerves. We connect this to an external device that powers those leads for approximately 1 week, and we're looking for a 50% improvement in your symptoms. If you have that improvement and you like the way your lifestyle has changed, then when we pull out the leads, we go over your bladder diary, and if it's something you want to pursue, we find a time to do a short outpatient surgery where I implant the device about the size of a flash drive or an Oreo under the skin, where it will hopefully work for you for the next 10 to 15 years before you would need a battery change. So over 375,000 people worldwide have had this treatment already. It's not experimental. We already kind of discussed the test phase here, but just keep in mind that 80% of patients have long-term success at 5 years out. Compare that to the 80% of patients that stop their medication after just 1 year. Also, please know that you can absolutely have an MRI with the newer devices. So any device we're implanting from here on out is MRI compatible. You just have to put it in MRI mode, and videos are available to easily walk you through that. So if you have significant bother, if you've tried lifestyle changes and pills, and you haven't had the relief that you want, then this treatment may be right for you. And it's trusted and proven. We have an 84% satisfaction rate among those who use InterStim for bladder control, a 3 times greater improvement in quality of life compared to medications, and 89% of people using Medtronic bowel control therapy experience long-term success. If you have further questions or I can be of assistance or you want to talk more, please reach out. I would love to speak with you about options to help you. You can call our office at 605-336-0635. Thank you for your time and have a great day.